Hi, my name is Ryan Harper, and I'm the host of Reporter's Notebook. And today we have Sarah Gray Barr here, who is our daytime reporter at Channel 9 News. And this month she's been focusing on mental health. How you been doing today?
I'm doing well. I've had a lot of time this month doing stories about mental health and speaking with different people in our community. And I think I've learned a lot about mental health this month, so I'm excited to talk about it. How are you today, Ryan?
I'm doing good. I mean, today was a little bit busy, so, I understand that everybody's constantly on the move. I just recently shot something and turned it in for the 6th, so we're doing pretty good today.
I mean, you and me, we have like such busy jobs. So one thing that I've learned is it's especially important when you have a busy job or a stressful job or a job where you have to meet tight deadlines. It's really important to take time for yourself so that way you can decompress, because if you're always running, eventually you're going to collapse. So
Yeah. Now, what made you want to focus on Mental Health Month recently? Because for those who don't know, May is Mental Health Awareness Month, and recently you covered a couple stories that tackled the topic. So.
Well, for one, we have our geographical counties that we like to cover, but there's also certain topics that different reporters especially like to pay attention to. For me, one of them is the environment, but another one is health and healthcare. And so since May is Mental Health Awareness Month, I've just been kind of using this time to delve into topics that I might not usually have time to talk about. And doing these deep dives in mental health, it is only... Part of it's happening because there are so many people who are hosting events because it is May, because it is Mental Health Awareness Month. And since there are all these events going on, I'm able to talk to the organizers at the events and use the expos and the conferences and the meetings they're hosting as a way to open the conversation into discussing mental health and mental health awareness.
So with these stories that you covered recently, what's something that you learned about mental health and something that you can take for a tip?
Oh, 100%. One thing, for example, today, today's Tuesday, I believe, ECU held its 11th annual Mental Health Expo. It's back in person for the first time since the COVID pandemic began. Sorry, I'm tripping over my words right now. The past couple of years, it was virtual, so they're happy to have it back in person. And I did not realize just how many mental health resources and substance use resources are available right here in Pitt County. I think they had more than 40 groups, 40 agencies in attendance at this event here today. I think the exact number is 48. And walking in the room, seeing people receive programs, brochures, flyers, and even pens and stress balls, I didn't realize how much was available. And as someone who didn't know that, I can kind of feel like I'm in the shoes of the people who are walking in for the first time seeing, wow, I didn't realize this much was available.
Right. Now, with all this knowledge that you gained recently, was there anything that surprised you or any statistics that stood out?
Let me think. I think I was speaking to someone from ECU Health, and he said, I think it was either 1 in 4 or 1 in 5 people struggle with mental health. So if you imagine yourself in a room of 100 people, that's somewhere between 20 to 25 people. That's a quarter of the people in the room struggling with mental health. So it's way more prevalent than we really talk about. Right. Which is why we need to talk about it, because it is so prevalent. And these events that we're hosting in the month of May, not we as in the station, but that we're covering, it's just one way to open that conversation, because who knows what happens once we open the conversation,
Right. Is there any advice that they give you to showcase, what's the most important thing that they say that you can look out for or just be aware of that people need to know about mental health?
I think that the number one thing is that if you notice something, talk to them. And if you don't know how to start that conversation, there are resources you can look for. There are people you can talk to give you advice of how to open that conversation. But what matters is that you try. Because if you don't open that conversation, it's going to stay shut forever.